Good day everyone, especially to you Ma'am Almira Buncales. My name is Ivan Simadera and for today I'm going to discuss the environmental causes. So what is environmental causes? Environmental causes are traced to a psychological disadvantage which is a combination of a poor social and cultural environment early in the child's life. So, agkan ko nung environmental causes mo kuno ni ag mga hinungdan ngano agatong nay bata wa pagi-anak na may mga disorder nga mahitabo. So the term developmental retardation is used to refer to mild mental retardation thought to be caused primarily by environmental influences such as minimal to develop early language, child abuse, land neglect, and or chronic social or sensory deprivation. So, the term developmental retardation mo kuno ni tawag sa mga mga grabing nga mental retardation tungod sa example is tungod sa child abuse and other causes. So next, prenatal causes or those that originate during conception of pregnancy until before birth are chromosomes disorders such as trisomy 21 or what we call Down syndrome, phenylketonuria, and Williams syndrome. So I'm going to tackle the different types of syndromes. First is the Down syndrome. Down syndrome, named after Dr. Langdon Down, is the best known and well-researched biological condition associated with mental retardation. Caused by chromosomal abnormality that most common is trisomy 21, in which the 24th set of chromosomes is a triplet rather than a pair. So, Down syndrome is a condition in which a person has an extra chromosomes. Babies with Down syndrome have an extra copy of one of these chromosomes 21. So that the name Down syndrome is also known as the chromosome 21. A medical term for having an extra copy of one chromosome is trisomy. Down syndrome is also referred to as trisomy 21. So, the characteristics of Down syndromes are short stature, flat, broad face with small ears and nose, upward slanting eyes, small mouth with short roof, protruding tongue that may cause articulum problems, hypertonia or floppy muscles, heart defects are common, susceptibility to air and respiratory infections. Older person are at high risk for Alzheimer's disease. So, agkan ako nung mga na ay Down syndrome ag kasagaran mo man atang gitawag karon og kanang mga mongoloid. That is the example of the baby that have Down syndrome. Next syndrome is Klinefelter syndrome. Klinefelter syndromes, males received an extra X chromosome, sterility, underdevelopment of male sex organs, acquisition of female secondary sex characteristics are common. Males with XXY sex chromosomes instead of the normal XY often have problem with social skill, auditory perception, language, sometimes mild levels of cognitive retardation. This condition is more often associated with learning disabilities than with mental retardation. So, Klinefelter syndrome, usually a female baby has a 2X chromosomes and or a XX, and a male has 1X and 1Y or XY. But in Klinefelter syndrome, a boy is born with an extra copy of the X chromosomes or the XXY. That is the example of Klinefelter syndrome. Next is the Fragile X syndrome. A triplet or repeat mutation on the X chromosome interferes with the production of FMT1 protein, which is essential for normal brain function. The term FMT is the Fragile X messenger ribonucleoprotein 1 or the FMT1. Majority of males experience mild to moderate mental retardation in childhood and moderate to severe deficit in adulthood. Female may carry and transmit the mutation to their children but tend to have fewer disabilities than affect male. It is the most common clinical type of mental retardation after Down syndrome. It is characterized by social anxiety, avoiding eye contact, tactile defensiveness, turning the body away during face-to-face retardation, and stylize. Ritualistic forms of greeting, preservation speech often includes repetition of word and phrases. So, Fragile X syndrome kono, mao kono ni ag mga mental retardation nga kanang magbalik-balik ag kuan ilang karakteristik na ni kanang magbalik-balik og istorya da mo avoid sila o kanang na eye contact, then tactile defensiveness. That is the example of Fragile X syndrome. Next is Williams syndrome. Williams syndrome is caused by the deletion of a portion of the 7 chromosomes. Cognitive function ranges from normal to mild and moderate levels of mental retardation. The characteristics are elfin or dwarf-like facial features. The physical features and manners of expression exudes cheerfulness and happiness. Overly friendly, lack of reserves towards strangers, often have uneven profiles of skills, with strength in vocabulary and storytelling skills and weakness in visual spatial skills, often hyperactive, may have difficulty staying on task and low tolerance for frustration or teasing. So, ag Williams syndrome ko no mao ko nig mga tao nga mga kusog sila rasa ka ng mga story ra, but in the kanang ilang dawi diak mas hinay kuno sila diak. Then the Williams syndrome is a rare genetic condition. It is characterized by distinctive physical and Williams syndrome physical features and behaviors including facial appearance, mild intellectual disability, and overly sociable personality. That is the example of Williams syndrome. Next is Prader-Willi syndrome. A syndrome disorder caused by the deletion of portion of chromosomes 15. Initially, infants have hypertonia or floppy muscles and made to be tube feed. It is associated with mild retardation and learning disabilities. Behavior problems are common, such as impulsivity, aggressiveness, temper tantrums, obsessive compulsive behavior, some forms of injurious behavior such as skin picking, delayed motor skills, short stature, small hands and feet, and underdevelopment genitalia. So ag kaning Prader-Willi syndrome mao ni ag mga tao nga dili ag ilahang mga chromosomes. Example na ni kanang mga mabagkamot og tiil, then dili naa sila'y problema sa ilahang impulsive, ilahang lihok o kanang sa ilahang pulso. Then next is that is the example of Prader-Willi syndrome. The phenylketonuria or PKO is one of the inborn errors of metabolism. Is a genetically inherited condition in which a child is born without an important enzyme needed to break down an amino acid called phenylalanine found in dairy products and protein-rich food. Example of PKU syndrome. Developmental disorders of brain formation include cranial malformation. In anencephaly, the major portions of the brain are absent. This is a major neural tube defect that is, it occurs in the brain or the spinal cord. In microcephaly, the skull is small and conical. The spine is curved and typically leads to stop portion and serve mental retardation. In hydrocephaly, blockage of cerebrospinal fluid in the cranial cavity causes an enlarged head and undue pressure on the brain. Environmental influences include maternal malnutrition, irradiation during pregnancy, juvenile diabetes mellitus, and fetal alcohol syndrome or FAS. FAS is one of the leading causes of mental retardation. The mother's excessive alcohol use during pregnancy has toxic or poisoning effects on the fetus, including physical defects and development retardation. So, agkan ikonong FAS or what we call the fetal alcohol syndrome, maone ag kinaunhang causes nga nung magka mental retardation ag isa ka bata tungod ni sa pag inom og mga alcoholic nga mga alcoholic, then or kanang mga poisonous effects or kanang mo take og tablets ag kanang naay burus. Then FAS is a diagnosis when the child has 2 or more craniofacial malformation and growth is below the 10th percentile for height and weight. Children who have some but not all the diagnostic criteria for FAS and the history of the mother's prenatal alcohol exposure are diagnosed with fetal alcohol affect or FAA, a condition associated with hyperactivity and learning problems. Though accidents, particularly vehicular accidents, are the leading causes of childhood head injuries. So, number one reason why child got head injuries are the vehicular accidents. The term shaken baby syndrome, which is a type of a child abuse when a crying infant is violently shaken by a frustrated caregiver, can result to head injuries. So, og ikaw inahan or ikaw nagbantay sa bata og naghilak ng bata og di nimo tarangon og kanang na-shake, maka-cause po na siya og syndrome nga gitawag og shaken baby syndrome. Infants' heads are disproportionately large. Their neck muscles cannot support the stress of this shaking, causing the head to flop back and forth. This often results in internal bleeding and brain damage, or in some cases, even death. Oftentimes, other diagnoses are given, such as traumatic brain injury. So, kay og di nimo tarangon og am-am ng bata or di nimo tarangon og shake maka agkana kanong bata dagko pa kuno nag mga so di ka support ng ilahang muscles sa ilahang liog, so maka-cause na sila na og internal bleeding and brain damage, or some cases makakuan po na sila maka-cause og death. So, cultural familial retardation refers to the existence of lowered intelligence of unknown origin associated with a history of mental retardation in one or more family members, though there are specific unknown causes in some cases of mild mental retardation. Typically, it is thought to be cultural familial. The condition results from the lack of adequate stimulation during infancy and early childhood. That's all. Thank you.